Okay, I'm just checking my voice. If you can hear my voice, can you type yes or Y? Okay, great. Thank you, sister. Sorry. So, yeah, no, that's fine. So, maybe that was just second life. It was just acting up, and after relogging for some times, it just started working. So, yeah, it's absolutely fine. It happens. Okay. So, uh, yeah, I think some people have joined. Uh, just let me open my notes, which I have made for this session. And also, I'm recording this session, so those people who could not attend, they can check it later on. Okay. So, at the end of the session, I will share the YouTube channel link, and anyone who found this session helpful, informative, and they can share with their friends and family. And if you ever miss any session here, you can find that on that particular YouTube channel after a couple of days. So today our topic is a little bit different topic. So we have had 8 to 10 sessions here so far, and we have talked about the benefits of mindfulness meditations and how we can integrate mindfulness meditation with our daily activities. Like there are different kind of mindfulness meditation that we have discussed so far, like breathing mindfulness, which is the foundation practice. Then we have talked about body scan mindfulness, then five sense mindfulness or 5 4 3 2 1 practice. Then we have talked about walking mindfulness, how we can practice mindfulness while walking, or doing any kind of exercise, be it yoga or tai chi, qigong. And also we have talked about some kind of mindfulness which we can do at any moment, like seeing mindfulness, like taking or looking at the art and looking at it mindfully, or reading something mindfully, watching a movie or watching a video mindfully. But today we are going to discuss that when mindfulness um, does not give us some benefits, okay, or when mindfulness does not work, or when mindfulness backfires, okay. Just like any other activities, mindfulness may not be beneficial for each and everyone for all the time. There are some mental health conditions, there are some illnesses where initially mindfulness does not work. Maybe when their stress level goes down, when their depression goes down, then they can start the mindfulness and they can see the benefits. Okay, so that is today's topic, because since I am sharing the information about mindfulness, it is also my duty to inform you about the downside of mindfulness, or when mindfulness may not work, and I will also explain you the reasons that why mindfulness does not work at that particular time. So I will go through some different kind of points, and I will tell you, and also I will share when I was going through my mental health crisis, and I was admitted in a mental hospital where I stayed for 3.5 months. I met some patients who did not get any benefit from mindfulness. So that will also I will share. So the first thing, the first condition where mindfulness may not be very helpful, or mindfulness is not recommended, if a person goes through psychosis, or if a person, experience psychosis. Anyone knows here what is psychosis? You must have heard about a disease called schizophrenia. uh, Anyone knows what is psychosis? Hmm. Okay. Okay, sure, no issue. I will tell you. So, mhm, fine. So, psychosis is basically, a mental health condition that actually interferes with a person's perception of reality. Okay, and we know psychosis with another term, these things are quite interrelated. Like people experiencing psychosis may have hallucinations or delusions. Now, I think you must have heard these two words, hallucinations and delusions. Okay, so mostly those people who are suffering with schizophrenia. Okay, and there are many movies which are made on this schizophrenia. There is one movie which I really liked and which I loved. And that the movie was The Beautiful Mind. Russell Crowe played the role of a famous mathematician, probably. Yeah, he was a mathematician, John Nash. So that movie was it portrayed the this particular disease called schizophrenia, and there are many other movies. So those people who are experiencing hallucinations, so hallucinations could be of different types, like seeing things that are not there, or seeing things which are not real, hearing voices or sounds which are not there, uh, feeling sensations without any reason, smelling something that are not present, or tasting things that aren't there. So there are different kind of hallucinations, and each hallucination has different name, like visual hallucinations, auditory hallucinations, tactile hallucinations, olfactory hallucinations, where people experience different kind of smelling odors. Yes, so it is very nice movie. You all can watch it. And the person was actually suffering with schizophrenia. So those people who are going through any kind of hallucinations or any kind of delusions. So delusions are basically false beliefs which are not based on reality. And many people suffer from delusions. Like there is one kind of delusions called paranoid delusions, where people think that others people are plotting against them. They are doing some conspiracy. Um, some another kind of delusions where they have the god complex. So they think that they are invincible, they have special power, or they have special abilities. And in sometimes it's known as god complex. They think that they can do anything and they can dominate anyone. And another kind of delusions where they think that their thoughts are controlled by other people, their thoughts are manipulated by other people. So those people who are going through these two kind of conditions, hallucination, delusion, which comes under the mental health condition which is called psychosis, mindfulness will not be very helpful. It may happen that when they are practicing mindfulness, they have more vivid hallucinations. Okay, that can also trigger their hallucinations. So those people who are going through this condition, and these conditions are, to be very honest, very serious conditions. Okay, going through these hallucinations and delusions. So those people, doctors and mental health practitioners or psychologists, they do not recommend them mindfulness. Okay, this is one thing. Second thing, those people who are going through any kind of mania, okay, any kind of manic episodes. So for them also, it was found that mindfulness was not very beneficial. Okay, and again, mania is a kind of mood disorder, and it is characterized by abnormally elevated or irritable mood. Sometimes these kind of people may experience increased energy and activity. They have rapid thoughts, like they can talk rapidly and excessively. They experience a racing thought inside their mind, and they feel increased energy and activity levels, and they also feel impulsive behavior. Now, again, mindfulness can help them, but when they are going through these manic episodes, first they need some medications to change the biochemistry of their brain. Definitely, mindfulness may help later on, but when they are going through that severe kind of manic episode, mindfulness is not recommended. First, they need some medicines, they need some therapy. Like one particular disease is very common where people experience manic episode, and that is bipolar disorder. You must have heard about bipolar disorder. Now, some people have mild bipolar disorder, some people have different kind of bipolar disorders are there, and they have this kind of manic episodes. So the best thing would be to minimize their manic episodes, and then they can start the mindfulness. Um, so that is the two things where mindfulness is not very helpful. One is psychosis, and another one is mania, any kind of manic episode. Okay. Another particular disease or mental health disorder where it has been found that mindfulness is not very helpful. And when these people delved into mindfulness, they felt more anxiety, they felt they were more depressive. Okay, so one such personality disorder or a mental health disorder is borderline personality disorder. Okay, now, what is the issue with this particular mental health disorder? That people inflicted with this particular disorder, BPD, which is known as borderline personality disorder, they cannot uh, regulate their emotions. They cannot manage their emotions. They cannot, they are not flexible with their emotions, and they are driven by their emotions. So for these people who are suffering with borderline personality disorder, mindfulness is not very helpful. Or even if these people practice mindfulness, sometimes they may experience more anxiety, more panic. Okay, but again, they can practice mindfulness when their disease or their symptoms are manageable, moderate. But when they are going through their severe condition, mindfulness will not be helpful. Okay. Um, just give me 1 second. Okay, now in another place where mindfulness is not very helpful, when a person is going through severe depressions and is having suicidal tendencies. Okay, severe depression and suicidal tendencies. So we should not recommend mindfulness to those people. That time, the best thing is to seek professional help from psychiatrist and psychologist, and they need some medicines. Okay, to change the brain's biochemistry at that point of time. Then again, when they feel better, when their suicidal tendencies are less, when their depressions are less, then they can start with mindfulness. But in heightened depressive situations or suicidal situations, mindfulness will not be very helpful. So this is another condition. Now, these are what we have discussed so far are some mental disorders or mental health disorders. Now, mindfulness may not work for some general people as well, those people who are not suffering with any kind of mental health condition. For example, one such example is those people who has difficulty focusing. Okay, maybe they are not suffering with any kind of focusing disorder like attention deficit hyperactive disorder, or there is some other kind of disorder. But if they are not able to focus, because in mindfulness we have to focus on our breathing. Okay, when we are doing five sense mindfulness, we have to focus on our senses. Okay, so we are seeing, we are listening, um, we are tasting, we are smelling, we have to focus. So those people who have difficulty focusing, and even after practicing mindfulness for some time they are not able to focus, mindfulness may not be very helpful, and mindfulness may make them more irritating, like they might feel some irritations and bad mood and bad temperament. So that is another conditions where mindfulness may not be helpful. But yes, when they can focus, when they can concentrate, their concentration power increases, they can start the mindfulness. Okay. Uh, Another place, okay, there are two things which is very important in mindfulness, because mindfulness is composed of two important part. One is awareness, another is acceptance. So mindfulness is a very non-judgmental practice. Nowadays mindfulness is being used with proper clinical study, with research, with tangible effects that we can learn from many different research. But earlier, like 1,000 years back, 1,500 years back, only those people who had interest in Eastern spirituality, mainly Buddhism, they only practiced mindfulness. Normal people did not practice mindfulness. Okay, so if people are not interested in mindfulness and they do not have proper faith, not a blind faith. Like, even in every session I always tell some research finding which has been conducted in some universities or some medical colleges. Why do I tell that? So that you develop some faith, not blind faith but a rational faith. Okay, so this research was conducted on 100 people, 90 people were benefited, so I can also get some benefit if I practice mindfulness in proper manner, in a correct way, under right guidance. So that is a good faith. But there are some people who are not interested at all, and after 2 3 days practicing mindfulness, they just say that it doesn't work. Don't waste your time in mindfulness, because they are not interested, and they preach their own opinion or their own viewpoints. But we that is the reason we need to go through different research, because mindfulness is not a pseudoscience. It's not a pseudoscience, it's a scientific practice which is used in all over the world, in different places, starting from schools, colleges, even in prison, even in corporates. And I don't know, I have never gone to USA, but one of my friends said that in USA mindfulness is a $1 billion industry. I don't know if anyone here, you are from USA, America, you can tell me whether it's true or not, but I have never gone there. But she said that, Bodhi, you do not know. Mindfulness is a $1 billion industry in USA. But we need to remember mindfulness has some limitation as well. So that is today's topic, that in which condition mindfulness does not work, and mindfulness has some downsides. So Those people who practice mindfulness with some kind of judgments or some kind of expectation, mindfulness may not work for them. Okay, so suppose I have sat for 10 minutes and I'm trying to do some mindful breathing, and when we do mindful breathing, different kind of thoughts will come, and that is inevitable, no matter whether you are a Zen master or no matter whether you are a novice. Only the difference between the Zen master and novice is Zen master knows how to tackle those thoughts, and the novice may not know, and they may get driven away by those thoughts. But it is inevitable. Thoughts will enter our mind. Uh, yeah, monkey mind. Yes, exactly. So in Eastern spirituality, our mind was considered as a monkey mind because it is always going from one branch to another branch without having any logic, without having any rationalities, just making us mad. So yeah, it's a monkey mind. Uh, and we need to practice mindfulness with awareness and acceptance. Okay, acceptance means we are trying to, yeah, monkey business. Yeah, Julie is right. You can say it's a kind of monkey business. So uh, we need to practice mindfulness with awareness and acceptance. Acceptance means I am trying to experience the present moment as it is without projecting my own opinion, my own thoughts, my own expectation, my own agenda. If I do that, mindfulness may not work for us. So there was one study which was conducted, and I am quoting this study from a famous psychology website called Psychology Today. And this study uh, found that those people, uh, this study was conducted with some students in a university, and the researcher found that those students who paid attention to their experience but with a judgmental attitude, okay, like judgmentally observing, had the poorest emotional outcomes after having these mindfulness sessions, including the highest level of depressions, anxiety, and emotional instability. If you want to look at this research report, I can share that with you. So just give me 1 second. Yes, I shared that report with you. So they did mindfulness. Yeah, you're most welcome, sister. So they did mindfulness, but they forgot the like one quintessential uh, aspect of mindfulness, that, okay, Suki is saying, so they were going through the motions but not internalizing it. Uh, they were going through the observing part, Suki. So in any kind of mindfulness, we observe or we witness, but they were they were not doing it in a non-judgmental manner. So if any thought comes, if any sensation comes, anything that they experience, they were labeling it as a good or bad, or maybe boring, or maybe not interesting. So in mindfulness, we actually become a non-judgmental witness to our own thoughts, and we do not label it whether it is a good or bad or ugly or depressing or anxious or euphoric. And that is the main thing, that is the crux of mindfulness, that not to be judgmental. So this particular study, later after the session you can go through, that if you do not practice it in a non-judgmental manner, it may not give us benefit, rather it can make you more anxious and depressive. That was the research report was all about. Okay, um, just give me 1 second. Okay, so this is one research which talks about the downside, and also, like I have mentioned a few mental health conditions where mindfulness may not work, especially when they are going through the intense phase of their illness. Okay, fine. So the next thing is, even there are different kind of mindfulness meditation. We need to find out which works with us. There are five, six different kind of mindfulness. We may not be comfortable. We may not be inspired doing all those six kind of mindfulness. So we need to find one which we are very comfortable with and which we enjoy, which we do it effortless manner. And we need to find out, like, if you do not like sitting cross-legged like a yogi and doing mindfulness, like which is known as breathing mindfulness, we can do mindfulness walking or washing your dishes, or maybe doing tai chi or doing yoga. Or you can, when you are having a cup of tea, you can practice five sense mindfulness, which is basically touching five things, seeing five things, touching four things, hearing three things, smelling two things, and tasting one things. And then you can have your cup of coffee, which sometimes I practice in every day. You can do whatever you feel good about it, and it should not be something which um, kind of imposing, like you were just being imposed by mindfulness. Okay, definitely, when we do mindfulness, the first 1 month, 2 month, it takes time. We do feel irritating. We do feel restless. We feel that it is not working, and we feel demotivated. And that is very normal, and that happens with any subject. If you play piano, if you learn piano, the same thing will happen. If you learn yoga, the same thing will happen. And one Harvard professor said that if it's making you anxious, if it's making you irritated, then it's working. True. But in some situation, mindfulness may not work. That is what I was talking about. Maybe you can find some alternative practices like yoga, like deep breathing, like visualization. Although there is a mindfulness which combines visualization, which is um, loving kindness mindfulness, or in Buddhism, it's known as metta or metta. Okay, metta mindfulness meditation. So METTA. Yes, right, right, Sunny. Okay, so we need to remember that mindfulness has shown proven benefits by different through different researches, which is conducted in clinical setup, and it is very beneficial for our mental health. It is very beneficial for our physical health, but it's essential to understand that it might not be suitable for everyone. And I have already discussed, like, what are the different conditions, like those people who have psychosis, manic depressions, certain personality disorder like bipolar disorder, sorry, borderline personality disorder. So for these people, it may not work. And sometimes mindfulness do not work because we are doing it haphazardly. We are just rushing. We want to be a Zen master in just 2 days. We want to levitate to here, thinking that mindfulness will make us levitate. And when we have this kind of expectation, we get disappointed, and then we blame mindfulness, that, oh, mindfulness does not work, don't waste your time doing mindfulness. So it's a gradual thing, just like any other subject. It takes time, because when we practice mindfulness, inside our brain, different new neurons um, are born, which we know, which we call neurogenesis, and different connections are made. Some synaptic connections are made, which we call synaptogenesis. So Yes, yeah, I saw you were levitating. Oh, now also you have become a very advanced mindfulness practitioner. But I don't know whether mindfulness can make you levitate or not. I have seen it in movies, in Chinese movies, even some old text. But yes, right, right. So, uh, so these are the even I also wonder whether it's real or not. I have seen some documentary where a old Buddhist monk was famous for levitating 700 years ago. Even I have heard about a monk in 11th century, the only person who climbed the Mount Kailasa. No one could climb that mountain. So, but I don't know. These are stories, and we love reading such stories. I have read stories about Shangri-La or Shambhala, which is there in a hidden realm in the Himalayas, where some advanced yogi stays and they have eternal life. They are in perfect health and they do not age. Yes, yes, yes. Yes, they probably learned it from Cecil. So yeah, these are some utopian places are there, some utopian stories are there, but we do not know how true that is. Maybe if we can levitate ourselves one day, then we will have more faith and rational faith. So yes, so these are the conditions where mindfulness may not work, and we should not forcibly try to do mindfulness when we are having this kind of uh, disorder or when we have this kind of illnesses. So today's session, I just wanted to give you a picture. I just wanted to share some informations which I have found, like for what kind of people and for what kind of disease. Initially, mindfulness may not work, and even when I was admitted in a mental hospital, I told you like I was there for 3.5 months, and there is a one video on our channel where I shared my mental health crisis and my mental health journey, that how I came into mindfulness, how I found mindfulness. Even at the starting, my doctors, the psychiatrists, they did not teach me mindfulness because that time I was not in a condition to sit and focus on my breathing. So initially, they gave me medicines, mainly SSRI medicines, to increase the serotonin in my brain, some antidepressant, and the therapy. And I went through a ERP, exposure response prevention therapy. After 1.5 months, they taught me mindfulness. So initially, they did not teach me mindfulness because they knew that maybe I would be more anxious practicing mindfulness that time, and I would say that mindfulness does not work. I will be demotivated. So that is the reason they did not teach me mindfulness right after I got admitted, although they taught me mindfulness after 1.5 months, after 2 months. Same thing happens with any other kind of mental health, mental illness. Like if a person is going through severe depression, if a person is going through severe manic episodes, if a person is going through severe suicidal thoughts, mindfulness may not work because they are not in a right sense. That time they need some medications to change their brain biochemistry. And when those neurotransmitters like dopamine, oxytocin, and serotonin, when they function normally, then they can start with mindfulness. So it's very normal thing. Otherwise, people will try mindfulness and they say that it's not working. Don't try this. It's a stupid thing. So, these are the conditions where we need to remember that mindfulness has some downside. Although for other people, mindfulness has given always beneficial outcome. And even some meditators, some people who has practiced mindfulness meditation for a long time. There was a research, okay, and they took 25 people who were practicing mindfulness meditation for a long time, and they have questioned, they have interviewed them, and they talked about some irritation, some restlessness when they started their mindfulness journey, maybe in the first couple of weeks. But these were not permanent. These are mostly, kind of transitory. And they got over those things after a couple of months of their practicing mindfulness. So initially we may find some difficulties, but as we practice, just like any other subject, learning new language, playing a musical instrument, learning a new sports, very similar things with mindfulness. But there are exceptions which we talk today. Now I can take a few questions. If you have any question, I'd be glad to answer you. And then today we can close our sessions. And so this is the YouTube channel where I uh, post all the sessions. So later on you can check that. So this is the channel you can check. Okay. Now, any question, or if you want to share your experience, that is also fine. Like you practice mindfulness and you found it was not working, you felt more anxious and more overwhelming. That also you can share, and I can try to explain why it happened and how we can minimize that kind of thing. Any questions, or you can share your experience as well. Yeah. Okay, that's fine. Even in future also, if you have any question, you can ask on our Discord, or you can befriend me. You can send me IMs whenever I get any time. I have a very busy real life, so sometimes I'm not online, or sometimes I'm online, but I am away from keyboard. Um, okay, epitome. Yeah, that's fine. That's fine. So you can ask me question anytime, because uh, I really like to help you in your mindfulness journey. Yes, no issue. So um, again, we will meet next Monday, and we will talk about some research report. We will talk about some mindfulness activities. So overall, mindfulness is very beneficial. Mindfulness is very profound mental exercise which can really alter our brain. Okay, like it can change our brain structure, and it has been found. I have talked in one session about this particular thing, like mindfulness and neuroplasticity. Okay, you can see that session. If you have any question, I can ask you that, but it has some limitation which we need to uh, know. Okay, thank you, Julie, and thank you everyone for coming and participating. We shall meet next Monday. Namaste, and thank you everyone.